Okay, today's date is July 23rd, 2013. We're here with Rebecca, who has come to see me primarily for knee problems, and she's also got significant pain in her low back. X-ray report says that she's got close to bone-on bone in the medial compartments of both knees. The lateral compartments are moderately advanced, not highly advanced. And the x-ray of her low back says she's got mild facet joints, but to her it's rather severe. I'll summarize for you what she just told me, and if she doesn't like what I say, she'll make faces. She's been to an acupuncturist, and while the needles are in, often she has 100% relief of pain while the needles are in. But when they come out, bang, right? You're back to square one. Can't get off the table. So I haven't done anything else with her at this point. Her doctors wanted to do a knee replacement. That's how bad it is. But one of her requirements was to shed a few pounds. Otherwise, the knee replacement might fail. Is that fair to say?
Yes, 100 pounds.
They want 100 pounds. Okay. You're being very open here, and I really appreciate that. And her husband is in the background, and you've given me permission to video this and post this on YouTube. Is that correct? And, yes. And you too. Thank you. Okay. What we want to do now is I want to see you get off of that chair and walk to the door and back. Okay?
Once I get going, I get better.
Okay. And go back again to the door. What we're looking at is this waddle.
Yeah,
okay.
I do waddle. I don't know if you can. I don't know if I'm doing it, but I do waddle.
Okay.
I've been told.
Thank you. Okay. Okay, now we're taking a movie of Rebecca's knees, and you can see the left knee actually is flat, so it straightens out fully. Rebecca, can you please bend that knee for me as far as you can? Okay, that's as far as she can bend her knee. It's a significant loss of motion. Okay, now let's take your other knee, and let's see how far you can bend that. That's about 90 degrees, and there's a lot of pain with that, correct?
Yeah.
Okay, now make your knee as straight as you can, and the viewer can see she can't straighten that knee. Rebecca, we just did tooth number 2, so I'd like you to get up off of the table. And I'd like you to walk to the door and come back to me and back to the door. Okay, now please sit down on the chair. All right, and please get up. Okay. And what was it that you were saying about there could be more movement?
This seems like there's a little more movement this way rather than this way when I walked.
Okay, in other words, less waddling like this.
Less side to side and a little more forward and back.
And a little more forward and back. So let's do that one more time. Okay, come on back. Is there any difference in the pain in your low back or your knees after that?
My knee pain is increased.
Your knee pain is increased.
It is, especially on the right one. But my low back seems to be the same or less.
Okay, but not dramatic.
Not yet. No,
okay,
not dramatic.
Thanks. Rebecca, we just did prolozone on your knees. I'd like you to pick your right knee up and let's see it bend as far as you can. That's better. Definitely better. Wow. All right? What'd you say?
I said, wow, yeah.
Okay.
It was
now, put it down flat if you can. Can you straighten it?
It's as far as it'll go.
Okay. What do you think? What do you make of that? Does it look straighter to you?
It looks a little bit straighter.
Looks
yeah.
a little
yeah,
bit.
There's,
Okay.
Yeah, there's a little bit less gap between the back of the knee and the table.
And let's see now your left knee. Please pick that up and bend it as far as you can. That's significantly better.
Yeah.
Okay, now let's see you get up off the table. And you can put your feet down on the stool and walk to the door, please.
Oh wow, this is nice.
What?
This is nice. This is nice.
You like that?
Oh yeah.
Okay.
Wow, this is great.
Let's see you get down, up and down off that chair, please.
That's good.
All right, please get up.
Oh, way better. It's way better.
Okay.
Wow.
So the question is, do you have any strength in your legs to be able to bend your head at the knees?
Now,
Oh, I hear it. Okay, that's
yeah,
yeah.
Rebecca, I want you to know, I want to remind you and the viewer, I did warn you. I didn't know what we were going to get with your knees because you've had previous surgery. There's a lot of derangement. You couldn't straighten your right leg out. And I said, I don't know what we're going to get.
Precisely.
Okay. I did tell you the truth that we generally see about 80% results in knees, but your knees is not the typical knee problem that we
Right.
see.
Right.
Okay? So far, so good.
Yeah.
Okay.
Yeah, dramatic.
Now we've just done Rebecca's back, and she's getting off of the table.
She's a scaredy cat.
Yeah. Can I see your face?
Always scared.
I know. Okay. Now, let's see you walk to the door and back, please. Come on back.
I'm not waddling. I'm not waddling.
No.
I think the viewer can see that. I was going to say it, but you said it. Say it again, please.
I'm not waddling.
Okay.
I can't believe it. I can't believe it. That's all I can say. My hips are moving the right way.
Thanks. Sir, do you have any comments about what you just saw?
It's wonderful. I haven't seen her walking like that in years.
Would you have believed this if you didn't see it right up front? No. Okay. Go ahead and walk to the door.
As scary as that was, it's awesome. I was frightened, but this is amazing.
Oh, I know you were frightened.
Okay, well, so
Let's
now
see
now you
you.
get to walk home.
Oh yeah.
Yes. Sit down on the chair now. Please sit up. Please get up. That's definitely much better, okay?
Yeah.
Do that again, please. And please get up.
It was so much easier. It was just like night and day to me.
Okay.
I might have to do that 5 or 6 more times just to make sure I like it. Unbelievable.
Say that again.
It's unbelievable. I'm blown away. So I wonder if I can sit down without.
Oh my gosh! Do that
without
again.
My arms. I don't know if I can get up without them.
That was a shock to me.
To me too.
Till you actually got up. I could see you getting down without support.
I can't. I haven't been able to sit down.
But to get up without support?
Unbelievable.
Is there any pain left in your low back?
Maybe about a 2.
2 out of 10.
Yeah.
You came in with 10. Okay. And your knees?
The left one pretty much 0 to 1. The right one about a 2.
Okay. And the right one was worse?
Yeah.
Okay. We know you have a major problem in that knee.
Right.
All right. Time will tell. I told you that we need to see time go by and see what happens here. But I'm very hopeful. That was a really good sign for your low back.
Yeah.
Majorly good sign.
Amazing.
Your knees, we'll just have to see what happens there.
Well, in between the pain when I came in, my low back hurt more than my knees when I came in. So to have it knock down all those notches really helped. And of course you could see I couldn't do this. I couldn't do this. I didn't even trust myself to try. And I couldn't do that. That's astounding.
I'm taken aback by you getting up and down off that chair without arm support.
Yeah.
Yeah. I did expect improvement. That's why I do this work. That kind of improvement I didn't expect.
That's astounding.
I think I'll label this video. That's astounding. Is that
It's
okay?
astounding. I think that would be a great
All
way
right.
to do it.
Thanks.
Thank you. Wow.
Rebecca, you got a gorgeous smile on your face right now.
Thank you.
Any comments before you leave?
Just thank you. I can't thank you enough for how amazing today has been. I didn't know what to expect, and it's far exceeded anything I could have expected.
I'm going to tell you the truth. It far exceeded anything I would have expected to. I'm being honest with you.
Thank you.
I've seen miracles here. I really have. Your case, I didn't expect what I saw. So time will tell, but it's really nice that you're so pleased. It's been about 15 minutes since we did your injection, okay? So let's see you get out of that chair. All by yourself into the door.
And I still walk like a normal human.
No waddle.
I walk like a human. No problem. No problem.
Okay, and
I could be a model today. I could get a wiggle in there maybe.
oh, you remind me of another woman that I did who did a little jig for me when we did her knee. She couldn't believe. Look at do that. She did, and she just swung her hips. She was about 65, and I videoed her.
Oh,
Okay.
It's amazing. Look at me sit down.
Control, sit.
I have a controlled sit. I was able to sit without any
Good.
pain.
Okay, thanks.
Thank you.